Hi, I'm Vivian, and we're here at Port Jefferson Pilates in New York. We're going to do our second collaboration video today, where you can see how physical therapy, Alexander Technique, and Pilates can all be employed to help you with your own problems.
Marsha, tell me a little bit about what brings you in today.
Some osteo in my left hip, and I also really always want to work on my posture.
So normally a joint fits together smoothly and nicely, but with osteoarthritis you end up with extra pieces of bone inside, and that causes pain and limited motion. So what I'm doing right now is I'm increasing the space inside of her joint to allow for better fluid through the joint to re-nourish. And then I'm going to have you go ahead and bring your heels together, toes apart, lift that knee up, 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 hold there. Perfect. We're going to hold that for about a minute. That will help significantly with your stability. I'm going to have you lay on your other side. I like to give this exercise to patients for 1 minute holds. You're going to actually extend that hip. Ooh. Hold and hold right there. Perfect. And then you hold that for a minute on each side. All right, hold there. And bend that knee just a little bit. Perfect. Perfect. There you go.
So she's going to have a little bit of a push into the pipes and a little bit of a pull down here underneath the scapula area. And I'm going to slip these on here. Pressing out from the sits bones. That's it. And pulling back in, nice and controlled. Keep it up here. We'll do a couple more. Good. And now she's going to hold it out for me, and we're going to go into circle. She's going to open first. That's it. Deepen and pull around. So we don't need to be so wide. We're going to keep it pretty small. Open, deepen, and pull those inner thighs together. Those are really important. Hold it right here. Inner thigh beats. Open and close. Just the inner thighs. Barely touch the heels. Soft, soft, soft on the knees. Always soft on the joints. And hold. Push down just a little bit. And here we go again. Inner thighs. Soft, 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 soft. Like you barely want them to touch. Barely want them to touch. And hold. And now we'll bring you back up. Good. Control on the way in. Powerhouse on the way in. Good. And rest. Bring your arms down to your side. Wonderful.
What I see here is there's a little more length that we could kind of get right at the top of her spine. There's a little bit of kind of like a tightness and a tension in the upper. You feel that? So how does that feel when I kind of give you a little bit of length? You feel like there's getting more space in there? Okay. So now come and have a seat. Yeah, so here if I try to turn her neck, it's a little bit resistant. Take some deep breaths. And as much as you're working hard, because there's some tension and it's kind of holding in the neck a little bit, we need to just find a little bit of that ease. So now that she's allowing me to move it a little bit, we can kind of focus on getting that length up there while you keep working on that lengthening up here through the spine. A soft image, maybe like a balloon taking you up at the top of your head. And then if you get a little bit of length and you tighten it all up, you don't get the quality of your movement. Yeah. Like the quality of life goes down when you're holding your breath and you're tightening everything.
So, Marsha, we're going to ask you, how do you feel after your 3 different modalities today?
I feel wonderful. I really feel lengthened. That's the biggest change, and I do feel,
Great.
And I have a cold, and it seems to have taken some pressure on chest and lung muscles.
Oh, that's so
which
great.
Is interesting. I didn't expect that. Yeah.
Great. Fantastic. Well, thank you so much.